blood vessels, starting with blood vessels of head and neck. The major vessels of the neck, there are two. There's the subclavian, under the arteries, subclavian artery, common carotid artery. Those are the two major vessels of the neck. Notice carotid is spelled carotid. I don't know why that is. Common carotid artery, subclavian artery, two major vessels of the neck. We'll start with the neck, get up to the head. We'll start with the common carotid artery first, but this coloring, kind of color those two in. Common carotid artery. Common carotid artery, you should already know that one from the heart. On the left side, it branches right off the aortic arch. On this little picture, it's right here. So that's the left side. But let's remember, because the aorta is on the left, to get to the right, you got to use brachiocephalic trunk, and then it branches into subclavian common carotid. Okay, so on the right side, there's everything on the right side. So those are the two on the right and the left. And well, on this picture, they're just giving you one side right here. Common carotid. Okay. You can feel it right by your big neck muscle, the SCM, the sternocleidomastoid. You can kind of take your carotid pulse right there. This one tells you pulse sites on the head neck area. There's one of them. That's spatial artery. I'm not sure. I think that's going to be subclavian right there that you feel. If I lean like way back and kind of feel I can kind of feel behind my clavicle. I can feel the subclavian. The subclavian, let's color that in next. I'll use a greenish color. It goes right under your clavicle. Well, on this picture, on the right and the left, here's the one on the right, branching off of the brachiocephalic trunk on the right side. Now the left side, it branches directly off of aortic arch, subclavian artery. Those are subclavian arteries, and on this picture here, this one right there. Those are the two major arteries of the neck. Coloring them in makes you see that quite clearly. So we'll come back to this and color other things in as we move along. But, I'm going to show you some of the pictures from the atlas that can help you learn these arteries. In this picture, they're stripping it all the way down to the bone. They're showing you some of the arteries and some other features of the neck. In the posterior neck, you have the cervical vertebra, C7 all the way up to C1. In the anterior neck, you have the hyoid bone. You have your voice box, the larynx. You have the thyroid gland, which we studied. This structure right here is useful to note. The superior border of the thyroid cartilage is kind of where the common carotid ends and bifurcates into the external carotid and the internal carotid. So we're write that down. Talking about the common carotid artery. The superior border of thyroid cartilage is where you find the carotid bifurcation. A bifurcation is a fork in the road. The common carotid, whenever you see the word common, you think, oh, well, it's going to branch somewhere. It's common to a couple of things. Carotid bifurcation, the common carotid artery bifurcates into the external carotid artery. This artery, as the name implies, it's going to give off branches that supply structures external skull, right? It's not going to go into the brain. Supplies blood to external skull. The other thing it bifurcates into is the internal carotid. So for the external carotid, also gives off many branches in the neck. Because you got to know it. Gives off many branches in the neck. The internal carotid artery doesn't give off any branches in the neck. Internal carotid artery gives off no branches in neck. So basically, I gave you a clue. You're looking at a model. Oh, okay, there's a carotid bifurcation, there's external, there's internal. Wait, which one's which? The one that gives off branches, external. If you see it going up the neck, not giving off any branches, internal. See this one's got this branch, this branch, there's more, okay? That's the point I'm trying to make. If you include tell those two apart. It turns out, where's my research? Sometimes I abbreviate internal carotid ICA. That abbreviation is used a lot. The internal carotid, it's going to enter the skull via the carotid canal and supply blood to the brain. That's pretty important to note. It's literally ICA, the internal carotid artery, is one of two arteries that supply blood to the brain. The other one's vertebral. We'll get to that. So look, hey, carotid canal, that's a skull structure. Thought you were done with the skull. You're not done with the skull. Look, there's a skull. You guys still got to know skull stuff. Okay? Moving on. So let's do the external carotid artery first, because those branches that you got to know. All right, there are three branches that branch off of this external carotid artery. Okay, let's back it up. Common carotid bifurcation, right? That's where you have that baroreceptor, right? Baroreceptor's in there on the carotid sinus, where it bifurcates. There's the external carotid. These three branches, as you go up, are superior thyroid, lingual, facial. We're going to write this down. Branches of the external carotid artery. Three go anteriorly. They are, well, I'll list them in the same order they are here. Facial, lingual, superior thyroid. Facial artery, see where it's coursing along the jawbone there? That's one where you could take a pulse. Facial artery. Does anyone know what lingual refers to? Tongue, yeah. Supplies blood to the tongue. And then, well, superior thyroid artery. I don't think the leader line is. There it is. It's one of two arteries that supply blood to the thyroid gland. Now, superior is a relative term. What's the opposite of superior? Inferior. Yeah, and there's an inferior thyroid artery that you'll have to know. We'll get to it. Branches off something else. Okay, superior thyroid.
Did you say the facial artery was where you check the pulse?
Yeah, right here. I can't feel mine. Maybe you can on yours. Feel along your jawbone so you can get a pulse. I'll move on to a different figure here. Still on the external carotid. There are two that go posterior. One that passes right, just posterior to your ear hole. It's called posterior auricular artery. The one that goes to the occipital bone is called occipital artery. Posterior auricular artery. Now, auricular refers to the ear. And then the one that goes to the base of the skull, occipital. Common mistake is to call it the posterior occipital. You drop the posterior. It's posterior auricular. Okay? Posterior occipital is incorrect. It's just occipital. All right, so those two branches you got to know. Those are major ones that supply blood to external skull in the back. On here. All right, there are two terminal branches. A terminal branch is the end of any artery. Okay, so basically, if this is, a generic example, if that's an artery and it branches, one goes that way and one goes the other way. Well, the two branches, the green and the pink, they terminate the black artery. So we just call them terminal branches. Well, anyways, the two terminal branches of the external carotid are maxillary and superficial temporal, as you can see from the picture. Two terminal branches. Maxillary artery. Remember the maxilla, mid-face? It's kind of going there. And superficial temporal. Those are all on your study list. Temporal bone, the sides of your head. You can see kind of where it's going. It's right in front of the ear hole there. Okay, this one is passing deep to the jawbone. It's going forward to the face. Like a picture you can study. Now the maxillary artery, it has many, many branches. And there's one I'll give you to know. It's called the middle meningeal artery. I'll squeeze it in here. A branch of maxillary that you gotta know. Middle meningeal artery. A little note on middle meningeal artery. You know, the meninges, the connective tissue coverings around the brain, not the brain, like the dura mater, you know, those. Well, anyways, these are in the dura. Branches of middle meningeal artery are in the dura. Basically, this one will enter the skull via foramen spinosum. Enters skull via foramen spinosum. So anyways, I just pointed it out there. It's there. It's branching off maxillary. That's important. Clinically. Let me show you some more pictures here. There's a picture of that artery entering the skull, and they cut the skull in a way in the sagittal plane, so you can kind of see it from the inside. You can see how it would be inside the dura mater. You know, the sides of your skull bones are the thinnest, and if you receive a blow to the head and you fracture a skull bone and it lacerates one of these branches and you can bleed on the inside of your skull, it's called a epidural or subdural hematoma. It's definitely one where you need a hole in the head to relieve the intracranial pressure.
Did you just say it goes through the dura mater?
It's in the dura mater.
In the dura mater.
Yeah, to supply blood to it. That model's right there. And then the guy, well, I call it a guy, I don't know what gender it is, but that model, that's one where you can find it. The blue arrow is pointing to middle meningeal artery. Okay, let's kind of go back and color some of these branches in. I think that was the same picture here, had most of them. There's superior thyroid coming off. Well, let's color in external carotid first. I'm coloring in external carotid. I'm using like an orange color here. So that was the external carotid. Colored in that orange color. And then I went through all the branches that came off of that sucker to supply blood to external skull. I taught the facial artery. Different color here. How about this purple color? Yeah. So always look for it right by the jawbone. They even draw all the way up here, going all the way up here to the orbit. Now usually on the test, I'll try to tag it right by the jawbone. And then where it goes dotted is kind of where it's kind of deep to the jaw. Okay, but that's the facial artery. Lingual artery in the coloring book, it's Q right there. And then superior thyroid. Just look for the one going down to the thyroid. Okay, so those are the three that went anteriorly. You had two that went posteriorly. Posterior auricular. So look for the ear hole. They call it posterior auricular to kind of help you with that. Yeah, W. Then the one behind that goes to the base of the skull, the occipital artery, S. And then the two terminal branches, the maxillary and superficial temporal. Okay, maxillary is teeth. Running out of colors here. Maxillary, I have this brownish color here, and it's all inside the skull here. This one right there. Okay, maxillary gives off a lot of branches. I'll just color in the one that I had you know. The middle meningeal V. I'll use a green color. And branching right off maxillary, it's right here. There's other branches listed there in the coloring book, don't worry about them. Those are there. I'm just going over the ones that are on your study list. Superficial temporal, that's the other terminal branch. So superficial temporal, I'll go back to this light blue color. It's right there. Now the coloring, I think it gives you a pretty good idea of how these things, where they are. It doesn't help you. I'm fine if you step out and drink a cup of coffee while I'm coloring, but I think for many of you, it will help you when you study the models. And that's really what you'll be testing on. Yeah, that's all of them. Okay. Any questions on the branches of the external carotid?
I kind of have a question.
Okay, go ahead.
What's the limb that's going in between the maxillary artery and the middle meningeal? Meningeal.
Oh, this one?
It's not colored. Yeah. What's that?
I think it's a branch of superficial temporal. Don't worry about it. Let me look that one up. Why? Transverse facial. That's the name of it. But you're not responsible for it.
I have a question. The maxillary, is it just that little short segment, or does it go?
It keeps going. It gives off so many branches, I didn't want to keep coloring it. But I just kind of colored where the main trunk is, and don't worry about those things coming off, but they're branches of it. If you look in your atlas, there's like pages on the maxillary artery because of all the branches. So just know middle meningeal. Yeah. Okay, I'm going to go back to use PowerPoint slides. Well, that's the carotid system of arteries. I have a few more pictures here. I call them topography of the face. This model is right there. We've got a bunch of half-head models, and they do show some of these models without what we're talking about. And so the pictures we've been looking at is just kind of arteries and bone, but the topography has much more structures, like muscles and nerves and glands. And one landmark that could be useful, this is a salivary gland. You ever take that first bite of food and feel a tingling on the side of your mouth? You're stimulating this gland. There's its duct. Anyways, we're not interested in really learning this now. It's more for digestion. But coming right out of there is the superficial temporal artery and vein. If you did a section, what you would see, if you cut through the jawbone there and get rid of the carotid salivary gland, is the terminal branches, they branch deep to the carotid salivary gland. Okay, that's kind of why I made this slide. Let me write that down. So I'm going to erase this now. Terminal branches, and let's remember that was maxillary superficial temporal, maxillary artery, superficial temporal artery. They branch deep to the carotid salivary gland. The blue arrow is pointing to that same place where they branch, deep to the carotid salivary gland. And well, yeah, that's the end of the external carotid when it branches into those two things. Okay, that completes the external carotid, and we'll come back to the internal carotid, but first I want to get to the subclavian artery. Here's a model showing it to you. There's a black arrow up there pointing to the one on the right. Just remember some anatomy I taught before. I said anterior scaling was a landmark for the subclavian vessels. The artery is posterior, and the vein is anterior to it. That's already in your notes. Write it again if you forgot. The anterior scaling. I may have you identify the landmark. This is not the muscle unit, but if I have you identify that muscle, because I want you to know it so you can find the subclavian artery and the vein. Right now I'm going to do the artery. And this figure kind of shows you why it's called subclavian. There's the clavicle. It goes underneath it. Okay? The three branches of subclavian I want you to know are thyrocervical trunk, vertebral, and internal thoracic arteries. So let me write those down. Branches of subclavian artery, thyrocervical trunk. It's a short trunk. That gives off a lot of branches. I'll give you one to know. The inferior thyroid artery is a branch of thyrocervical trunk. Thyro refers to thyroid, so you knew it was given a branch to that somehow. Inferior thyroid artery. Okay, that's one of the branches, thyrocervical trunk, and you have vertebral artery. That's an important one. Vertebral artery will ascend up the vertebra in the transverse foramen of C6 to C1. It ascends up neck in cervical vertebra. So the transverse foramen, I'll show you a picture later, just note it for now, transverse foramen. It's one of the unique things about the cervical vertebra, your neck bones. Anyways, okay. Vertebral, important. It's the other source of blood for your brain. The ICA and vertebral are the only two arteries that enter the skull to supply blood to the brain. Inner skull. The foramen magnum supplies blood to brain. Third branch, internal thoracic. Thoracic, chest plate. Are you going to find it inside or outside the chest plate? Obviously, inside. So we have chest plates. It's back there somewhere. I always like to kind of like look on the inside and tag this artery. I'll show you a picture of that. They flank the sternum. You got two of them. They're on the inside of the chest plate on the sternum. Here's a blank one you can study. So let's go back to this figure and color them in. We'll go back to this same one. Because they're all shown here. Should be back into this, right? So the first branch coming off was the thyrocervical trunk. That was E, letter E on the coloring plates. Gyrocervical trunk. Letter E. It's right here. And it's right here, coming off subclavian, on this picture here. I'm using red, by the way. Gyrocervical trunk. There it is again, coming off subclavian. That's one branch. The other branch is vertebral. That one's easy to find. I just look for the one going up the neck. It's going to enter the brain. Here it is, coming off subclavian, right down here. This is vertebral. And you can see, as you color, it's inside the transverse foramen of the cervical vertebra. So I'm going to kind of not color them as it goes through. I'm just going to kind of color all the way up. All the way up. Goes through the foramen magnum there. And it gets inside the skull, then they kind of like color it like that. On the other picture, they cut it short, but it's right here. Vertebral artery. So I use blue for that. It's blue. Then you had internal thoracic. I use this orange color. It's going down by the sternum. So on this picture, it should be C. Is that C? Yeah, internal thoracic is C. It's this one here. Right there. Should be this one right here. They don't call it letter C. I don't know why. Wait, that was internal thoracic artery. And wait, it's on the coloring. Okay, there you go. Those are the three branches of the subclavian you got to know. So to go back to where I was in the PowerPoint slides. We looked at this picture. Here's another picture. This picture from the atlas, the internal thoracic artery. There's a red and a blue vessel. That's the artery in the vein. Okay. Now, do you see how the sternum would be right there, but it's been removed? And do you see how the internal thoracic is giving up all these little branches? I don't know if you remember studying the posterior intercostal arteries. Those are branches of the thoracic aorta. These are the anterior intercostal arteries that branch off the internal thoracic. So, internal thoracic gives rise to anterior intercostal arteries. Remember, little a is my shorthand for arteries, plural. Ah, okay, I took a picture of Mr. Chest Plate. It's in the classroom. Look for it. I don't see it right now. I'm looking at that torso and there's no chest plates on it. These things have a tendency to move around by you. You guys hide them. Because you think we won't find it for the test. I always find it. You can't hide anything from me. Anyways, it's right here. See right there, those labels? Internal thoracic, artery and vein. So these branches coming off of it are the anterior intercostal artery. So this is the inside of the chest plate. All right, so moving on. Let's go back and talk about the internal carotid artery, domus subclavian for the time being. The internal carotid artery, I put this little picture here. Let's remember what we're looking at. Let's orient ourselves. We've removed the lower jaw, so that's the upper jaw. Maxillary teeth. That's foramen magnum. This is the cranial base, inferior view. So if you study that on the skull, look for carotid canal right there. Okay. Because that's how the internal carotid artery enters the skull. That should be in your notes. Enters the skull via carotid canal. If you look at a superior view of a cranial base, that's this picture right there. And there it is entering the skull. Okay. So I mean, look for the carotid artery inferior view. Look for it superior view of the cranial base. Here's a different view of the internal carotid artery. The internal carotid artery, I put this here. This is just the artery. And as you can see, when we studied it in the neck, the cervical part, right there, doesn't give off any branches. As soon as it enters the carotid canal right there, it starts giving off all these branches. Okay. They call this the petrous part because it's entering the skull through there. So notice that the carotid canal, it's not a straight canal. It kind of curves. It gives off all these branches. Notice how the artery, it curves and it curves back. As soon as it curves back, it gives one artery that goes forward to the eye orbit. If you look over here, as it curves back, it gives one branch that goes forward. That's the one branch of ICA you gotta know. It's the ophthalmic artery. Okay. So let me erase this. Okay, before I erase this, I forgot to color this one in, inferior thyroid, my picture. I'm a little anal retentive when I forget stuff like that, so I'm gonna go back and color it. This picture here. The inferior thyroid is a branch of down the cervical trunk right here. Okay. Okay, now I'm satisfied. Again, we're talking about the internal carotid artery. Again, pointing to, what's the one thing you gotta know about where this enters? Carotid canal. They name the different parts. You don't got to know the parts, cervical, it's all ICA. But I did give you one branch to know. OPH thalamic, ophthalmic artery. ICA, one branch, ophthalmic artery. Supplies blood to eyeball. Eye and orbit. Orbit is, the socket where your eye is in. So you got one branch, OPH thalamic. there's a blank picture you can study. Again, it's easy. There's only one branch, ophthalmic. I have a lot of pictures here of ICA and ophthalmic here. I put them all side by side so you can kind of like be better oriented. If you remove skull cap, if you remove the brain, you can see the cranial base. And I'm pointing to the approximate location of where the ICA enters the skull, right there. That is the optic chiasm where cranial nerve 2 crosses. So it's right around that area. There it is there, cut. But the one branch that goes forward to the eye is the ophthalmic artery. There's another branch you gotta know, that's right there. That's the foramen spinosum. That's middle meningeal artery. So this is a good picture to study for the internal carotid artery, ophthalmic artery, foramen spinosum, middle meningeal artery. That was a branch of maxillary. Again, giving you a billion ways to study ICA. This is what we looked at before, and this is what we just looked at. It's the internal carotid artery supplies blood to the brain. If you want to color it in on that picture I can keep going back to, go ahead. It's there. Did I color it in yet? Let's see. I did not. I did not color it in. I better do that. About green. There's ICA right there. There's the carotid bifurcation. It's coming up right there. Right next to the external carotid, giving off all these branches. It's going to go all the way into the skull there. Now I'm going to stop coloring it right there, where I stopped that green internal carotid. Because it's going to branch inside the brain. And the one branch I had you know was, here's ICA in this color. I had you know ophthalmic. They do show it on the coloring plate. It's letter M. Is the internal carotid. The ophthalmic is letter N, as in Nancy. So I'll use this purple color. Right there. There's a lot of blood vessels on this plate that you gotta know. So what I'm trying to get you here by talking about vertebral and then the internal carotid is so I can teach you how they both supply blood to the brain. If you look at the base of the brain, there's this, it's called the circle of Willis. Okay, I still call it that. It's more like a hexagon, really. But anyways, the two source arteries, you have this picture on your plate, are vertebral and internal carotid artery. So the internal carotid artery, again, we just colored it in. It's right here. Oh, jeez. I guess this doesn't match now. Okay, I'm gonna have to erase all of this. So this picture is a classic one that we have students study. You could study the arteries that supply blood to the brain on the base of the brain or on the base of the skull. So those are two possibilities for you. We have both of those in the lab. The internal carotid is one artery that enters the skull to supply blood to the brain. It's right here. I used this color before. I'll use the same color again. And the other source artery that supplies blood to the brain, I believe I used blue for the subclavian artery that gave rise to the vertebral artery. I used blue for vertebral, and it's right here. It's going to enter the skull via foramen magnum both of those, ICA and vertebral, are supplying blood to the brain, which you can see here. If you look at the base of the skull, you have two vertebral arteries, and they're right here. There's one vertebral. This one right there. Here's the other one. Okay. Same color, blue. Those merge to form basilar artery. Well, anyways, the ICA is shown right there. It's right here. It's letter A. So I use that light green color. All right, so there they both are. Okay. From the base of the skull or coming up from the neck. So it's like you can kind of start, where do you start? I guess start by talking about the vertebral artery, and we'll do the bottom half, and we can do the top half. So let's call those arteries that supply blood to the brain circle Willis. And again, our two source arteries. ICA, vertebral. Colored in green or blue. So, the two vertebral arteries merge to form one basilar artery. The basilar artery lies on top of the pons. That's kind of where you want to look for it. I'll use this purple color. You only see it right here. There's not a lot of branches there, but just know the basilar artery. One basilar artery. So, gives off a lot of branches. It kind of like ends by branching into the posterior cerebral arteries. There's two of them. So I'll use a bright orange color to color those in. Just look at the end here. You kind of branch out and go posteriorly.
Professor, are these branches off the vertebral artery? Is that what you said?
The two vertebrals, they merge together to form one basilar.
Okay.
Yeah. And then the one basilar will branch into two cerebral, posterior cerebral arteries. Okay, when I tag posterior cerebral, I'll do it really close to basilar. That's kind of like the lower half of the circle of Willis. To communicate with the upper half of the circle of Willis, there are two posterior communicating arteries. Not to be confused with posterior cerebral arteries. I'll use a red color there. They're just coming off right there, going up to the ICA. So that's how the bottom half communicates to the top half. Now the ICA gives off a lot of branches. The internal carotid, let's see here. The internal carotid is going to give off a branch that goes anteriorly. Those are called the anterior cerebral arteries. I'll use this light blue color. So look for the ICA, and it comes right off of it at the beginning, right here. And they go anteriorly all the way up there. Okay, see where I call it that light blue? And on the other side too, right off there. Now, to complete the circle at the top, there's a very short artery that connects the two anterior cerebral arteries. And there's one very short anterior communicating artery. Brown color. It is literally this short, just right there, from there to there. Boop. It connects the circle, so like you have collateral circulation from the right half to the left half. Now, if you look at this section here, I included this because it shows the anterior cerebral. That is that same color, that light blue. It curves around and follows the corpus callosum. Giving off a lot of beautiful branches along the way.
That's the anterior cerebral.
Yep, you got it. I'm staring at it right there. See this red artery on half head? What I just colored it, this looks exactly the same. So, you know, sometimes I tag that and you think I tricked you. Because you only study it in the one way. You're like, you don't know what it looks like from another perspective. You should try to know that. So, the anterior cerebral there and there. Okay, one more. Middle cerebral artery. The middle cerebral artery is letter D. Page right again. How I think of it as the internal carotid enters the skull, supplies blood to the brain. As soon as the ICA gives off this branch, the anterior cerebral, it continues on as middle cerebral. Okay. I'll use this pinkish color. So once again, ICA, let's follow it. As soon as the ICA gives off anterior cerebral, it continues on as middle cerebral. Right here, pink, middle cerebral. And the color on one side, not the other, because they leave the temporal lobe in, you can't see it on the other side. And that's the middle cerebral, and that's it. Okay, for the circle verse. So there's a nice picture in your book. I'll give you a page number there. It's the Atlas of Anatomy. We can study the circle of Willis. If you start from the bottom, what are these two? Vertebral. They merge to form one basilar. Gives off a lot of branches. The only one I want you to know is one on the top here. Posterior cerebral artery on one side and then the other. These one going up to the top half. Posterior communicating. Okay, that's ICA. Okay. There's the optic nerve and there's optic chiasm. That's kind of the pituitary stalk. Here's ICA. It's going to continue on. It gives off this branch, the anterior cerebral. There's the anterior communicating. As soon as it gives off that branch, it continues on as middle cerebral. All right. So, a couple models in the room you can study. This kind of has them. Brain with arteries. No, it's going to have some of those. Well, I put some more slides for the vertebral artery, just to remind students, the pages you can study. Coming off the subclavian. Way down here in the neck, it's going to go up the transverse vertebra, transverse foramen of the cervical vertebra, enter the skull right there. Okay, it's going to merge to form basilar artery. So let me show you this picture. I have a cervical vertebra isolated, and there's the transverse foramen. Remember the transverse process, those two side wings? In the cervical region, they have a hole. So they call it the transverse foramen. And so that's what the artery ascends up. The vertebral artery ascends through the transverse foramen, C6, C1. Then it'll enter the foramen magnum to get inside the skull. So let's talk about the venous drainage since we talked about the arterial blood supply. They're basically called dural sinuses. This is one model we have in the room. This model is right here. I call him Durahead. Okay, this one. And he has the dural sinuses in it. You kind of look at the base there from the top. So think of a sinus. It's like a vein. A sinus drains the brain, and they all merge down into the internal jugular vein. Okay. There's the model in the room you can study. We have Mr. Durahead, and we have these isolated. Now these blue vessels are the sinuses, and they're in the dural septa that compartmentalize the central nervous system structures inside the brain. So let me show you this picture to show you what I mean. Here's a quarter section of the cranium. Okay, this is basically your brain case. Here's brain in, no brain. Okay? Brain in, brain out, brain in, brain out. Well, anyways, let's study the brain out picture. Because you can see inside there are the dural sinuses, and they're all over the place. Well, anyways, these have names. I want you to know the falx and the tentorium. Those are dural septa that contain some of these sinuses I want you to know.
You said they drain into Which jugular?
Internal jugular.
Internal?
Yes. So what I said was the dural sinuses drain the brain. So they're contained within the dural septa. That's what these are called. The dural septa are just connective tissue, dura mater basically. There's only two dural septa I want you to know. The falx cerebri, tentorium cerebelli. Falx, tentorium, for short. I put this picture here, or this one here, because the big red line tells you what this septa separates. The falx cerebri separates the two cerebral hemispheres in the brain. Separates cerebral hemispheres. Now, within the superior border of falx is the superior sagittal sinus. And within the inferior border of the falx is the inferior sagittal sinus. It's a little smaller. So if I just kind of draw two blue lines, I mean, can you see how there's one blue line going from front to back? They kind of window it out there. It's the superior sagittal sinus. It's larger. The smaller one is the inferior sagittal sinus in the inferior border of falx there. Okay, so that's basically what I was trying to say. Now the other septum is the tentorium cerebelli. It's going to separate the cerebrum above from the cerebellum below. Tentorium cerebellum separates cerebrum, your brain, from cerebellum. This is drying out. Now, in the posterior edge of the skull right there, where the tentorium attaches, is going to contain a sinus called the transverse sinus. Because it's in the transverse plane. If you cut this way, if you cut this way, it's in the sagittal plane, and you have these two. So I give you different views This is a view of the dural sinuses in the dural septa. You can study them right on the brain too. They just look like regular blood vessels. All right, so let's kind of like use this as a reference point. This is the superior sagittal sinus. Here's the inferior sagittal sinus. Okay, so let me kind of continue on with this there. There's one, all of these collect to this one vein right here. That's the great cerebral vein right there. Let me draw that in my picture. Okay, so let's kind of start to number these. 1, 2, 3. One is superior sagittal sinus. 2 is inferior sagittal sinus. 3, great cerebral vein. They're all veins. They're returning blood to the heart. It's called sinuses. Well, anyways, then you have straight sinus right there. Straight sinus. It's going to merge with superior sagittal sinus. So we'll call this number 4. Straight sinus. All right, so kind of this point right here where we are, you got superior, you got inferior sagittal sinus, great cerebral vein, straight sinus. That point where they all merge is called the confluence of sinuses. They kind of all flow together there. This point right there, call it number 5, confluence of sinuses. It's going to be right in the back of your skull there, okay, posterior. Do you see how there's a blood vessel coming off, going to the side there, but they cut it because we're in the sagittal plane? That's the transverse sinus coming off. Let me show you other pictures. Here's a posterior view so we can see the confluence of sinuses better. So do you see how the superior sagittal sinus comes off and right there, confluence and branches off side to side? That's what I'm talking about, transverse sinus. As it goes down the skull, it makes kind of an S-shaped turn. It's called the sigmoid sinus. Sigmoid sinus, sigmoid means S-shape. Now, I don't really show it there either. There, you can see it there. This slide is pretty good. Confluence of sinuses, transverse sinus, S-shaped thing is the sigmoid sinus. So let me kind of continue my drawing here. So right there is going to be my transverse sinus. Remember, this is the one that's contained within the tentorium, number 6. Then it takes an S-shaped turn to go down the skull, sigmoid sinus. And then it's going to exit the skull via the jugular foramen. continue on as the IJV, internal jugular vein. The internal jugular vein, it runs with the carotid artery. It's the major neck vein. Okay. Well, there's kind of another picture you could study. I put the little inset to show you that this picture is good to study at home. This is what you want to study in the lab. Mr. Durahan's got all the sinuses in there. There are other veins in the neck besides the IJV. There's internal jugular, there's external jugular, there's anterior jugular, just those three. Okay, we'll keep it to those three. Now what you're looking at here is platysma, that's the muscle that helps you kind of like tense skin of neck. That's cervical fascia covering all the musculature here. You can see that this big neck muscle here is the is the sternocleidomastoid, and on top of it, you have external jugular vein. Okay, on top of the SCM. So basically, neck veins. External jugular vein, a portion of it overlies sternocleidomastoid. SCM is sometimes an abbreviation I use for sternocleidomastoid muscle. Okay, so basically I give you that clue. So you don't confuse it with internal. It's more superficial, it's external. The anterior one, well, just look for it anteriorly, not laterally. So I don't even give a descriptor for it. I'll just write anterior jugular. It's anterior. The way to find internal jugular vein is the picture on the right. If you do a dissection, and if you pull the SCM back, you should see the internal jugular. It's in a sheath called the carotid sheath. Internal jugular vein is located within carotid sheath. Look at the picture. You can see where it is. It's kind of posterior medial to SCM. Okay. Carotid sheath contains our vein, IJV, runs with the common carotid artery. There's also vagus nerve in there, but I won't ask you that in terms of identification. But the blood vessels you should know. Okay, the major neck vessels, the IJV and the common carotid, shown right there. So to start to get students to think about the next lab practical, which is when, you know that. What's next week? What day next week? Thursday. Okay, so some of you know. I just put pictures. These aren't meant for studies, so you kind of know. A lot of models. It's like if I show a picture, it's like, oh yeah, that has something. So you can kind of like, oh, this, I got this from this college, not from our college. I put it on the internet, so hey, you know, I use some of these models. They have labels on, labels off. I didn't make these, so it may not match my study guide, but I thought it was a good resource just to kind of cut and paste into my lecture slides. I would take a breakdown. Before I do, we are having a quiz tomorrow. It'll be fill the blanker. And I decided that, I think I gave you the slides already.
Yes.
Now, some of those slides were lower extremity because I thought I was going to cover that today. I just now decided in my own head I don't want to cover that today. So you're not responsible for the lower limb stuff on the quiz tomorrow. To be clear, for the quiz, you're responsible for head and neck, everything I just talked about. So if you go ahead and study those slides for nothing, well, it's not for nothing. You'll think that. You weren't responsible for the lower limb. Okay, you're only responsible for head, neck. Vessels, or tomorrow's quiz. I'll cover the rest tomorrow. So when you come back from break, it's not going to turn into a lab today. I just want you to give you guys some study time. But let me give you a look at the schedule so you can kind of balance out your study time. I want you to know exactly how much study time you're going to have. Because I don't, students are always like, oh, you're not giving me enough lab time. You know, there's one time a student said that to me, so I like ended lecture like an hour early. So she had like 3 hours. And guess what she did? She stayed for like 10 minutes and left. What I learned from that is never do what students tell me to do. Do the opposite. Okay, I won't. Give me a second to pull this up. I mean, I'm always fine if you leave early. I've never complained about that. But don't be complaining about not getting enough lab time. That's all I'm saying.